Good afternoon, everyone. Indo-US Chamber of Commerce of Northeast Florida welcomes you to the second day of our Wellness Weekend event. Thank you for joining us online. It has been a great pleasure for us to put together this two-day event just for you. Yesterday, our speakers from First Coast Heart and Vascular Center covered topics on heart health, women's health, knowing your symptoms, and taking preventive measures to take care of your cardiovascular health. Our recordings are available both on Facebook as well as on YouTube. You can watch it anytime. Today, our speakers will be presenting information on acupuncture, psychological well-being, Ayurvedic and energy healing, and even wellness of the pet. So thanks to our event sponsor for today, Blue Star Pet Hospital. And it is my pleasure to introduce our moderator for today's event, Linda Deschatos, DTM. Linda is retired from the financial industry where she handled communications in the mortgage industry. Linda currently serves our chamber as a director of communications. She is also immediate past president of the Deer Road Toastmasters Club. She has served Toastmasters for more than 20 years. She has mentored several people, including me, to improve the communication and leadership skills. Please welcome Linda D.
Thank you, everyone. It's my pleasure to be here today. I'm happy to be the moderator for day 2 of our Wellness Weekend presented by the Indo-US Chamber. Yesterday, we were very fortunate to hear from an array of experts and medical practitioners who gave us outstanding suggestions to keep us healthy. We want to thank again Dr. Vidra of the First Coast Heart and Vascular Center for bringing this esteemed group of doctors to talk with us. Today, we're going to take some roads less traveled in the world of human health and healing. And we're going to start off by talking about some different members of our family, our fur babies. Ladies and gentlemen, our first speaker today is Venkat Gouda, a doctor of veterinary medicine. Dr. Gouda came to the United States from India in 2002 to pursue a higher education, and that's exactly what he did. He attended LSU, Louisiana State University, their School of Veterinary Medicine, and then he went on to earn his master's degree in animal science from the University of Georgia, finally settling here in Florida, where he holds his veterinary license. Dr. Gouda's background includes 10 years with the Banfield Pet Hospital, where he gained extensive experience with soft tissue surgeries in the animal world, and he developed a reputation for excellence with his clients. He joined Blue Star Pet Hospital and Grooming in 2016, and they now have 2 locations, one at Bay Meadows and one at County Road 210 in St. Johns County. On a personal note, you need to know that Dr. Gouda and his wife, Sri, who is also a veterinarian, have 3 children and 3 pets. I know that's a noisy household that has a lot of fun and energy. Now, we know what a crazy year this has been for everyone, and how much more important our furry friends have become in our health and well-being as we have been ordered to shelter at home. Today, Dr. Gouda will go over some pet basics for us in order to make our relationships with our furry companions easier and more rewarding. Ladies and gentlemen, I give you Dr. Gouda.
Hi everyone, good afternoon. Can you guys hear me? Okay. All right. Thank you, Miss Linda, for giving me this opportunity. So, and also, first of all, I would like to thank Dr. Amit Vedre, who is a best friend and also like a well-known cardiologist in Jacksonville, Florida. I know, I know Amit for about 4 years, and so I learned so many things. And also, this is one other thing, he introduced into this Indo-US Chamber of Commerce. So I would like to thank Ms. Amuda Sundaram also. So as Ms. Linda mentioned that, I moved from India to pursue my further education. So I went to LSU Vet School, finished all my credentials, and I've been practicing in Florida for about 15 years. So today I would like to share some of your concerns regarding the COVID and also importance of having a pet and what are the basic needs you have to take care of for your pet. So I know many of pet owners, they are concerned and also they have some questions whether my dog or cat can contract a COVID-19 infection from any of my family members. So simple answer, just to avoid any confusion, I would say no, because there are no reported cases in the United States. There are only 2 reported cases so far in the entire world. There was one dog in Hong Kong and also one cat in Belgium. So the dog did not experience any kind of clinical signs, but the cat did develop very mild fever and just mild lethargy, just lasted for 3 to 5 days. But those are the only 2 cases. And also they did some studies in ferrets by experimentally inoculating the virus. Even those ferrets also developed only a mild clinical signs such as fever and mild lethargy, but there were no deaths reported. But I know a lot of people they have concerns whether other kind of animals will they get COVID or not. Only thing they found out in Denmark, so they do a lot of mink farming. So those minks, they transmitted COVID-19 infection to people. So that's the reason why they had to cull all those minks from those mink farms. Other than that, there are not many reported cases when it comes to animals as far as COVID-19 goes. But a lot of people, they still have questions. Let's say if one of my family member gets infected with COVID, so will I transfer that COVID infection to my dog or cat? So, I mean, simple answer is no, but it's better to be safe. Let's say if you get infected, take all the precautions, get isolated, and just wear your face mask and face shield. Just follow the CDC guidelines or AVMA guidelines, you'll be all right. So, and other people, they have questions. Let's say if my dog or cat has a COVID infection, will it transfer to human beings? So answer is no, because so far this COVID-19 transmission is human to humans, but there's no transmission from pets to humans. Originally, you all know I jumped from bats to humans. Now it's humans to humans. So that's why there's no need to worry if you have a dog or cat or any other companion pet. So you should not be worried that your companion pet is going to transmit COVID-19 infection to your family. So, and I do get some questions. Let's say some of the clients, they're curious. They just wanted to test if my dog and cat has a COVID-19 infection. But unfortunately, no one developed those testings in dogs and cats so far. So, I mean, most of the labs I used, IDEXX and Antec, they did not develop a test for dog or cat. So, and also there's humans to humans, I'll get the vaccinations. But other than that, there's no need to panic if you have a dog or cat, if it's going to transmit COVID to people. Okay. So, and the other thing, so during this year 2020, we all know we are experiencing a greater pandemic. I heard about this pandemic in my epidemiology textbooks and classes, but personally, this is the first time I'm experiencing. So, and also a lot of clients have been seeing in the beginning days, they were very concerned and stressed. So like staying at home all the time. But as time goes on, I noticed that like a lot of people like they became so like very well attached to their pets and especially like their dogs and cats. So and also like as a veterinarian, what I've noticed that like a lot of people like especially I started seeing like many number of new clients becoming like new pet owners. So and I would like to touch on a point like whether like we should have a pet or not, especially during this pandemic. So I would highly recommend to get a pet, uh, especially like if you are working from home, if you have a lot of leisure time, or if you don't have leisure time. Also, if you want to become physically fit and healthy, having a pet definitely will help you. I know like speakers from yesterday, they talked about like cardiovascular diseases in people. So they mentioned that like uh, lack of physical activity and stress are the major contributing factors for the cardiovascular diseases. So having a pet definitely like help you with those two issues, especially like your physical health and mental health. So let's say like if you have a dog, cat also like can give you a little bit physical and mental, especially like very strong mental health. But like if you have a dog, like definitely you take your dog for walks and you take like morning 20 minutes brisk walk along with your dog, you get really good cardio exercise. And same thing in the evening, like at least like 15 minutes to 30 minutes of like a brisk walk along with your dog, like will definitely improve your physical health. And also like a most important thing, you'll go outside. Like when you go outside, so like you'll get vitamin D. Like a lot of people in this country, they do have vitamin D deficiency. Even after coming to United States, I like my last physical exam showed that I'm also like having deficiency in vitamin D. So like so having a pet definitely like helps you to expose to sun and also like all the natural elements, so which is good for your body. And a lot of people like they are experiencing some loneliness and also like increased level of stress during this pandemic. So having a pet definitely help you like in terms of like avoiding loneliness and also like avoiding your stress. So in general, dogs and cats like they provide unconditional love. So like after your work day, or especially if you're working from home, if you're tired after like working for 2 3 hours, just go and play with your pet and see the difference. And you can take your dog for outside 10 minutes walk and you feel the difference. And also simply you can just lay down on the floor and pet your dog or cat, you feel the difference. So I mean, like I do see like a lot of my clients, like they come and experience, explain their like a joy, like how fortunate to have their like a pet in their family. So that's the reason why I do encourage like this audience and especially like any of the previous speakers and Indo-US Chamber members. If you guys don't have a pet, so please consider like adopting a pet or like just having a puppy or kitten. So I know like a lot of people so uh, have like questions like whether I should uh, really whether I'm ready for a pet or not. So let's say like if you're thinking about having a pet, just you need to consider like a few factors. So first and foremost thing, you should be financially ready. Once you have a pet, you have to take the full responsibility. Not only giving the shelter and food, you have to provide the veterinary and medical care. And also like things happen, like pets are like living things like accidents, diseases. So you should be able to help when it comes to that situation. And also, like a second thing, you have to consider your time. So there are like busy professionals, like they work from morning 8 to evening 5, and busy with family and kids, and see like how much time they can spare for their pets. So I know like when people they don't have a lot of time to take the pets outside, like those people they can consider cat as a pet. So they are definitely like a much time consuming compared to having a dog. So when you have a dog, like you have to socialize and also train them, and also like take them for regular walks. So, and the dogs are social animals, they need like you have to take them to dog park, and those kind of situations things will arise. You should be ready. And also before considering like getting a dog or cat, you should look into what kind of breed you're looking into. Like it all depends on your lifestyle again, where you live, whether you live in a condo or apartment or neighborhood, or like individual home, like with big acreage and property. So some breeds are working dogs. So like don't consider to get a working dog, like if you don't have enough time to provide enough activity to those dogs. So that's why do your homework before you get your dog or cat, like what kind of like care they need, and also how much time you can uh, provide. The other question, like a lot of times, people they ask me whether I should buy a puppy from breeder, or like whether I should rescue a dog from like a shelter or like a local pet rescue groups. So I would highly recommend to go and check out your local shelter. So by doing this, like you're literally saving a life. So, because those, especially shelters, like when they are overwhelmed, when they don't have enough space, so they cannot accommodate all those uh, dogs and cats in the facility. So, like some of those, they may end up getting euthanized. So that's why, if anyone of you considering like having a pet, please go and check out your local shelter and rescue place. Yes. And some people they would like to have a puppy. Like I can understand, like they would like to experience the puppyhood, and some people they love kittens and puppies. So, like getting puppies and kittens from shelter is little bit less possibility. But always before, like you go to a breeder or puppy store, go and check out at your local shelter and see if they have any kittens or puppies available for adoption. If you don't find, then you can always go to a breeder or puppy store. But do your homework, like whether you are getting a puppy from like reputable breeder or not. So, because some of those are backyard breeders, they just do a lot of inbreeding. You may not get a good puppy, and that too, you should not encourage those breeders. Like always do your homework before you get a puppy or a kitten. So I know, like once you get a puppy and kitten, one puppy or kitten, some people they go for one kitten, they end up having two kittens also. So, but make sure like you take your puppy or kitten, or like it's whether it's a grown-up dog or cat. Always make sure you take them to a veterinarian for initial physical exam. And at our Blue Star Pet Hospital, like we do complete, like we provide complete veterinary care, including the vaccinations, and also like a preventive care, like a heartworm and flea preventive cares. So those are the things like your veterinarian will like educate on you, like what kind of vaccinations your dog or cat needs, and also like there are some zoonotic diseases dogs and cats they carry, and they can transmit uh, to human beings. So that's the reason why you always have to take your dog or cat to a veterinarian and make sure they perform initial vaccinations to prevent especially like a deadly viral infections like a rabies vaccine and also parvovirus infections in dogs and leukemia and also like FIV in kittens. So those are all important things. And also like these dogs and cats, like they do carry some intestinal parasites. So make sure your veterinarian checks the fecal sample and also do proper deworming. Those are all important things. And yeah.
Okay, Dr. Gouda, you're talking about, I'm glad that you're on the subject of having a new pet checked out by the veterinarian. And I was kind of curious. Someone had asked me a question to give to you, which was, what would be the top 3 things that you'd want every pet owner to do before they brought the pet into the office? So if they think that their pet is not doing well, what would you suggest that they do first? Is it maybe a triage or something?
First thing, like they should call a veterinarian and find out, just they should book an appointment, because sometimes they may not get the appointment on same day. So, and they can check, they cannot really take vitals like in people at home because it's not easy to take a dog's or cat's temperature at home. So just make sure they're breathing, they're not like coughing and sneezing, and also make sure they're not having any runny stool or vomiting. Those are the main things. Of course, energy levels are important. Like if the pet is not healthy, like energy levels are going to be low. So as long as the pet's energy levels are okay, then like you can wait until next day. But main thing like breathing and also like energy levels and also like any kind of vomiting, diarrhea, those are the things they should look for.
Okay, great. And we have a question that's just printed across the screen for you. Can you read it? It's asking
are there any multivitamins you recommend to boost immunity for pets? Oh yeah, definitely. Like we do carry, we call like pet tabs. So basically pets, they do need multivitamins, especially like dogs, puppies, and kittens who had like any sort of like malnutrition, and if they had experienced any sort of like intestinal parasites, so they do need like a multivitamin supplement to boost the immunity. Not only the multivitamins, they also need probiotics. So because the combination of probiotics and multivitamins definitely boost the immune system, and that way those puppies and kittens will thrive.
Are there any other questions that we have typed up? Well, if not, a friend was telling me that he noticed on the internet that they were saying if your dog licks their paws a lot, that it might be the sign of illness. Is that true?
Yeah, that is true. Because especially we live in Florida, like it's hot and humid, we do have a lot of allergens. So, and most of these dogs, when they're licking and chewing on the feet, that kind of indicates allergies. So that could be a food allergy, and that could be like any like environmental allergen. So most of these dogs, if they're licking and chewing, that means those histamines are released on the paws. That kind of makes them to lick and chew. And a lot of pet owners, they notice those paws become like a very like a brownish in color. And also they do notice like a lot of redness and inflammation. That can lead to yeast and bacterial infection. Anytime you notice like licking, chewing on the feet and paws, if there is any redness and illness or redness and inflammation, you should immediately call us or call any of your veterinarian to provide the care as soon as possible.
Okay, great. I don't see anything else typed, so I'm going to ask you a question that my daughter asked. She and her husband are tremendous animal lovers, and they recently replaced a pet and had one in the house. When you introduce a new pet into the house, can you offer any suggestions for what one should do to, I don't know, maybe the other animal is jealous or scared or something?
Yeah, sure. That's a great question. First and foremost thing, you should always introduce the new animal in your presence. So, like, make sure you're available right there. If any sort of like aggressive behavior develops, you should be able to intervene and separate them. So, and the slow approach is always better. And just if you are giving like a toy or anything, like make sure like there are like two or three toys or like two or three different treats available, so that way they're not competing for those treats or like play toys each other. But it takes, sometimes it takes 2 or 3 months to get like get used to and develop like. So it also depends on like whether you are introducing a dog to a cat or like a cat to a cat, or it varies. So dogs are much easier to introduce to each other compared to cats. So cats are like so independent. So they definitely feel like a little bit more jealous compared to dogs. So
Okay, great. We're about out of time for your talk. I really appreciate you being here with us today and providing a lot of really common sense information for us, for our furry family friends. And what I'd like to do is ask you in just a minute or two, can you give me the top three bits of information you'd like the audience to take away? Just real quick.
yeah, real quick. So like number one, if you don't have a pet, consider getting a pet. Number two, if you have a pet, so make sure like you provide the proper care, like not only the nutrition and the physical health and veterinary health. So number three, so having a pet definitely makes your family complete. So just consider having a pet and provide the proper care and enjoy your pet.
Okay, great. Thank you so very much. I want to, on behalf of the Indo-US Chamber, thank you for being here and for sponsoring today's day 2 of the Wellness Weekend. Ladies and gentlemen, Dr. Venkat Gupta of the Blue Star Pet Hospital and Grooming Center. 2 locations. Good job, Dr. Gupta. We'll see you again.
Thank you. Thank you for this opportunity.
Thank you. All right, ladies and gentlemen, next up, I would like to take us on a switch. We're going to switch back now and start talking back about us, the two-legged and less furry members of the family. Yesterday in our Wellness Weekend, we heard from experts in Western medicine. Today, we're going to turn our attention to alternative healing philosophies. And we're going to start that journey with hypnotherapy. It's a misunderstood and often maligned course of treatment. Today, we're going to hear from Dr. Karen Phillips, who obtained her master's degree in family counseling and her doctorate in educational psychology. She has 25 years at the Center for Hypnosis and Counseling, where she brings a lifetime of experience and knowledge to her practice. In addition to her private practice, Dr. Karen, as she likes to be known, works with a nonprofit organization called Military Warriors Support Foundation, where she mentors combat wounded veterans and their families, and where she's had an opportunity to develop skills treating PTSD and traumatic brain injury. Dr. Karen has told me often that she feels fortunate to have found her calling to help others to break bad habits, alleviate negative thoughts and behaviors, overcome fears and debilitating phobias, and to relieve stress and anxiety. Here to tell us all about it, ladies and gentlemen, is Dr. Karen.
Thank you. A big thank you to Linda Desater, who is today's event coordinator, and I would also like to thank the Indo-US Chamber for the opportunity to speak on a topic that I feel so passionate about. That topic is taking control of your life. That topic is hypnotherapy, which is riddled with so much misinformation and skepticism. I have a background in psychology and counseling, and as a therapist, I'm extremely goal-oriented, which means I do not want my clients sitting on my couch for years and years. So what are the tools I use in my bag of tricks to resolve issues quickly, thoroughly, is hypnosis. Hypnosis is a relaxation process. You're fully aware. You know what's going on around you at all times. You're not asleep. You're not in a trance. It's not hocus pocus. You're not made to bark like a dog or act like a chicken. When you're relaxed, the subconscious part of your brain can take in suggestions that you want, suggestions that you agree with. You can't be made to do anything you don't want to do. You are in full control at all times. And how this works. Let's take smoking. Somebody has to really want to stop smoking for hypnosis to work. I can't make anybody do anything they don't want to do. But if somebody wants to stop smoking or break a destructive habit, hypnosis works best on that. Suggestions are put into the subconscious part of your brain. When you're relaxed, the conscious part of the brain is the part of the brain that says, I've got to stop smoking. It's a terrible habit. It's killing me. The subconscious part of your brain is everything you've ever seen, heard, learned in your lifetime, and that is stored in the subconscious. So maybe people smoke because years ago when they started, it was the cool thing to do. Maybe they smoke because their parents smoke. Maybe they continue to smoke because it's not going to kill me. I'm not going to die from it. No, not me. A lot of people are still smoking for those reasons. And there's a pull, conscious, subconscious. The subconscious is just so much more powerful. So when someone is a little relaxed, suggestions that they agree with are put into the subconscious, and it gets the conscious and the subconscious to be on the same team. Takes the edge off, makes it easier. Usually, because hypnosis works best with habits, one session is all that's needed to stop smoking, and I have a 90% success rate. So let me talk more about hypnosis. Have you ever driven somewhere and you get there and you wonder, how did I get here? Did you ever daydream? How about getting so totally absorbed in a book or a movie? You're in stages of hypnosis. We go through that every single day of our lives. So we go from the conscious to the subconscious on a regular basis. What I've used hypnosis for throughout the years are many, many things. It works best for habit control, stop smoking. Once you stop drinking, a lot of it's habit related, stress management, anxiety. Now, we spoke about how bad stress is. No matter what I do hypnosis for, one of the byproducts is stress reduction. It's wonderful. For all those things, including basic fears that I mentioned, you need a very mild hypnosis. 1 or 2 times usually works. A deeper hypnosis is achieved by just doing it more and more and more. It's a learning process. Deeper hypnosis you need for pain reduction, deeper anxieties, phobias, age regressions. Oh, I love age regressions, where you bring somebody back to their childhood so they can look at the baggage they're bringing into their adulthood, and they can actually eliminate it by sorting it out, just going back, reliving. It's a wonderful, wonderful tool that can be used in therapy. Now, of course, you have to be careful who you go to. You want to go to somebody who has experience, because remember, your conscious mind is taking a back seat to your subconscious mind. Hypnosis works with visualization. It works with imagery. It has nothing to do with gullibility. People who are more susceptible than others to hypnosis usually are people who can use visualization, use imagery. They're people who are strong-willed. Now, by strong-willed, I don't mean a negativity. People who like to be in control, you would usually think wouldn't be good with hypnosis. That is just the opposite. Well, what if you are a control freak? What if you have a very strong mind? What if you're stubborn? Well, of course, you're going to think hypnosis won't work for me. Actually, it's just the opposite. All of those, and I'm calling them qualities, will give somebody the ability to do what they want to do. They can work to your advantage. So hypnosis is a powerful technique, and it can make profound changes in your life. I have used it for PTSD, post-traumatic stress disorder, with very good results. So my purpose as an educator is to clear away the myths associated with hypnosis. I've worked with hypnosis personally, professionally. I've trained other professionals to use it for over 25 years, and it does absolutely no harm. People always ask, what if I don't come out? And I always say, come out of what? There's nothing to come out of. The most that can happen is you love that state of relaxation that you're in, and you just want to stay there longer. You can stay there as long as you want. However, everybody comes out of hypnosis. There's no harm. The worst that could possibly happen is nothing. Again, stop smoking, 90% success rate. Eliminate habits. Hair pulling, eyelash pulling, nail biting, nail picking, skin picking. You can overcome fears and phobias. I have used hypnosis with public speakers. I have used hypnosis for Broadway stars that actually had fears of going on stage. I have used hypnosis to enhance sports performance because you have to see in your mind's eye where a ball is going before you pitch it. You have to have a positive attitude. You can't let the last poor shot that you made in golf screw you up for your next shot. There is a definite mind-body correlation. Hypnosis can reduce pain. It can uncover and heal past difficulties. It can create more potential for a person. It can help you with studying, retention. But of course, it doesn't work for everybody. Nothing works for everybody. But if it's a good method for you, you can achieve some wonderful results. Are there any questions?
Actually, Dr. Karen, I have a question. And I have to confess to everybody that I know Dr. Karen for a number of years, and I don't know, I don't want to cluck like a chicken myself, but I am a control freak, and I was the person who has always been fearful that I wouldn't be in control. Now, it sounds pretty interesting that I don't really go into a trance or anything, and I am kind of sort of wide awake. So my question is this: since COVID has changed everything in our lives, and you talked about being on the couch, can you actually perform hypnosis or hypnotize somebody?
I've been
over
doing
Zoom?
it. I have used Zoom. I've used FaceTime, and yes, it can be done. During the hypnosis, my voice will have a very special place in someone's subconscious. And what I do is give them what's called a post-hypnotic suggestion. Some deep breathing. Deep breathing is very important. We know that in life. It's also important during hypnosis. So the deep breathing with some words can bring a person's subconscious back to where the suggestions go in, and it can give them a powerful jolt. So what I will do is do the hypnosis to see if somebody responds to it. And if they do, I can get them into a relaxed state on the phone, with Zoom, in my office. It really does not matter. Interesting to know that working on the conscious level, remember conscious, subconscious. Conscious is what we are right now, Linda, right? You're conscious. We're all conscious here. I'm working on the subconscious. So working on a conscious level to get rid of a habit is like trying to get rid of weeds in a garden by skimming off the growth above the earth. You're not going to get rid of those weeds. So we try to resolve habits consciously. It needs to be done subconsciously. The roots will always remain if you just skim off the growth above the earth. They're locked in the earth to grow again. Hypnosis cultivates the inner mind and helps pull out those weeds.
Okay. We
So
have a couple of,
you said one more thing, which I'm just going to address quickly.
sure.
You are alert and aware. You're not asleep, but you're in an altered state of consciousness. So it's like the time you go to sleep, right before you go to sleep, where you're drifting. You're not asleep, you're awake, but you're in that zone. That's hypnosis. So it's an altered state of consciousness.
Okay, great. Now we have a couple of questions that'll be coming up. There's one right there for you.
Oh, yes. Okay, I will read this. Any thoughts on hypnosis and blood pressure or depression, and any resources or resources? Okay, yes, I have resources, and you're welcome. Because hypnosis is a natural relaxation process, it alleviates stress. It helps somebody calm down. I have people come see me who say, oh, you can't hypnotize you. I'm me. I'm a type A person. I'm just hyper. I never calm down. Well, relaxation is a learning process. The more you do it, the better you become. And the people who are just hyper, some of it is habit. So hypnosis definitely helps with blood pressure. Oh, no doubt about it. Depression. Yes, it can help with depression. It helps with anxiety. I've used it throughout the years. The last resort, I think, is medication. If you can concentrate hard enough with your mind, concentrate on giving yourself a bellyache, a stomach ache. Can you do that? I can. My mind is powerful. So is yours. So if we really concentrate, we can give ourselves a stomach ache. So if we really concentrate using our mind, why can't we take that stomach ache away? We can. I have used hypnosis for migraine headaches using visualization and imagery. I've used it for phobias, fears. Fears are pretty easy, basic fears. The difference between a fear and a phobia is debilitating. A fear is something you'll do, but you'll white knuckle it. Hypnosis works good on fears.
Yep, we have another question for you.
What are key questions you can ask a therapist in your field to best qualify them to work with an individual, both young and old? It's an interesting question. Through the years, I've always been asked, can you do the same hypnosis for someone who's young and someone who's old? And I don't know what old really is. So I'm going to say the key to hypnotherapy and counseling and therapy is individualization. I will not do the same hypnosis for someone who's 25, let's say even trying to stop smoking, as I will with someone who's 50. Individualization and the questions to ask a therapist with hypnosis. Are you certified? There's no certification. Certified to me means they took a weekend workshop and they get a piece of paper that says they're certified. So I would ask, where did you learn to do hypnosis? What brought you to hypnosis? Do you use it just for habits? Because I want somebody who uses it for many, many other things. So what's your school of thought? And I started using hypnosis in my bag of tricks as a therapist because I didn't want someone, and I'm going to repeat this, sitting on my couch for 10 years when I may be able to use hypnosis and resolve an issue in 6 months. I hope I answered your question.
Okay, yeah, you did. And I have to add to that question that it's been my experience throughout my lifetime that not all counselors are made the same. Some of them very nice, well-intentioned, but cannot help your need. So sometimes we need to shop around to find the best person who we can connect with. Okay, were there any other questions? Karen, I'm going to ask you, oh wait, here's another one.
Can hypnosis help with making difficult life choices like breaking from toxic relationships? Yes. Yes, yes, yes. I have used this throughout the years. Believe it or not, I even use hypnosis with marriage counseling. And you're saying, why? Why would you do it if a couple comes in? Most times, and I'm generalizing now, most times when someone comes to me for marriage counseling, the woman's the one who talks and talks. And the man will sit there and say hardly anything. I'll do a little hypnosis. He'll become so relaxed. It's kind of like he took a little relaxation something pill, and I can't stop him from talking. And it's wonderful. So toxic relationships, I usually do a combination of hypnosis because with any toxic relationship, there's a habitual component, a habit. So the hypnosis works best on habits. So between the hypnosis and the counseling, it can do very, very well. But you must remember, not every technique works on everyone. It depends on the person. Linda, I can't hear a word you're saying.
I got it, yeah. Mike
okay.
is on now.
Okay.
Okay, I don't see any other questions, so I'm going to ask you to give us your top 3 tips for people. That's something that you'd like them to take away.
Number 1, you don't have to live with negativity, negative habits, negative situations in your life. Life is too short. It's time to take control. Number 2, hypnosis is a credible treatment for helping you take control of your life. I merely guide you on a journey of positiveness, a journey to help you to be the best you that you can be. And number 3, just remember, if you ever choose to do hypnosis, you are in control and you will not bark like a dog or act like a chicken unless you choose to do so. Thank you.
Woof, 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 woof. All right, well, thank you very much, Dr. Karen Phillips, for all the information on hypnotherapy. Ladies and gentlemen, instead of taking a pill, take a little relaxation with Dr. Karen. I want to tell you how much we appreciate you being here today with us in day 2 of our wellness weekend. Before I bring our next guest up, I want to tell everybody a little bit about the next step in our journey on alternative healing. We are going to turn our attention now to the Eastern healing philosophies, specifically acupuncture and Chinese medicine. Today, to help us explore, we have with us Dr. Rosemarie Allen, who is an acupuncture physician. She's also a certified physical therapist assistant, a massage therapist, and a certified health coach. Dr. Allen has worked in the healthcare industry for over 20 years and has fine-tuned her acupuncture skills with great results. And that comes right from her patients, I'm included. Her greatest attributes are being able to listen to her patients and to deliver the therapy that they need based on centering of the heart. She is the owner of A Balanced You Acupuncture and Wellness Center. They're located in the Riverside area of Jacksonville. And there you can partake in acupuncture therapy as well as acupressure, acumassage, cupping, and a number of other treatments. Here to tell us all about acupuncture, ladies and gentlemen, Dr. Rosemary Allen.
Hi, guys. Thanks for having me. Thank you so much to the Indo-US Chamber of Commerce for having me for this talk today. And as Linda said, I will be talking about acupuncture and acupressure with focus mainly on boosting your immune system and also on stress management. So I'm not sure how much many of you know about acupuncture, and this is one of the things I've always been asked is how does acupuncture work? So my goal is to try to tell you a little bit about how acupuncture works and the benefits of it. So acupuncture has been around for many years, thousands of years. And it has been found, the ability to balance the system, balance and harmonize the system. That is how acupuncture works. So acupuncture works by means of what they call meridians. Meridians are energy channels that are located in the body. Every single living thing have meridians. Every single living thing has an energy stream that goes in. The energy stream can be compared to highways running back and forth, just like we have our highways. And then the acupuncture points are the gateway that access those energy. So I'm just going to show you briefly. I'm not sure if you can see my acu guy. Those lines that you're seeing on him, those are the meridians, the streams of there. You can see there. And it's on the front, it's on the back, it's on the head, and everybody has them in the same places, right? So even with animals. So somehow someone figured this out many, many years ago. And I joke about it that somebody probably fell in a porcupine and said, oh, my back feels better. And that's how it all started. That's a joke, of course. But anyways, I have been studying, I've been doing acupuncture for the past 16 years and have had some amazing results. And one of the things that I found is that because acupuncture treats a little bit differently, it doesn't treat everybody the same way. We actually look at each person's individually. And the first thing about it is that you have to get an evaluation. With the evaluation, we're looking at deeper at the person's problems, whatever it is that they say. That's a complete interview that we sit down and have with the person with regards to their condition. Then we have to take a look at their tongue, and then we have to look at their pulse, because everybody's tongue has a geographic presentation of the organs internally. So we look at that, and then we check the pulse. And I'm going to show you this. I'm not sure you can see it because of the glare of the light. And this is how I look at it. So each tongue has a different color with the coat. We look at the coat. We look at the size of the tongue. We look at the color of the tongue body. We look at the color of the coat. We look on the underside of the coat. All these are indicative of what's going on internally. Then we also check the pulse. And there you can see the pulse. With the pulse, we're looking at that, and that also tells us what the characteristic of the energy is for each organ system. There's 12 different systems that I check when we check the pulse, and that will tell us and always correlate with what your words, what your interview said, and what your tongue said. Everything usually correlates, and this is how I come up with the individualized diagnosis for each person. No two people have the same issues. The treatments are formulated individually to match your issues because it's coming from you, okay? With the acupuncture, there's different, everybody usually asks about the needles, and there are different sizes of the needles, and the needles are really, really tiny. So those points that I showed you on the little guy there, the points are like the gateway, the access way that you access this energy channel. So the needles come in very different sizes. Not sure if you can see them, but these are really tiny. The red that you're looking at is really the tip of is the handle of the needle. And they come in different sizes. These are individually packed. They're sterile. And they're one-time use. That's important for me to tell you. They're one-time use. They're only used that one time and then we get rid of them. So they're different sizes. So depending on where on the body we're putting them, this one actually has 10 needles in the pack. And this also has 10, but this is a different size needle. So if we were putting it like in the thigh or in the butt cheeks area, it's a little bit more muscles there. So you have to use that. And then we also use what we call ear seeds. This is one that's made from a plant called Vicaria. And this one, usually use it on the ear for the most part, because the Chinese look at the ear as an upside down fetus. And that is also a microsystem of the whole body. So depending on what we're working on, we can use these ear seeds in points in the ear that are associated with the organs that you have internally. And you just keep it in 3 to 5 days. You can keep it in as much as 3 to 5 days. And this actually prolongs the effect of the treatment. All you have to do is just massage it, okay? So with Chinese medicine is just a small, acupuncture is just a small portion of traditional Chinese medicine. And so right now, today, I want to talk a little bit now about the acupressure, since I gave you a standard basis of what acupuncture is. So acupressure is really applying pressure to acupuncture points. And this is something that people can do on their own without coming in to see me. There's things that you can do to help to keep your body well. So the acupressure is you have to know what points are available to use for what purposes. So what I'm going to do right now, I am going to share my screen so I can share my PowerPoint that I have prepared for you guys. Share screen, where is it? Share screen, share screen. I'm waiting to get it shared. For some reason, the share button is not opening up.
Yes, and our backstage crew is not seeing the request.
Okay, so I entire.
Can they ask if you can click on share?
I see it, but it's not blue. It's hard line. I can't share it.
Okay, maybe we'll just move on without it. Can you talk it through?
Can you see it now? Are you able to see it?
It says to click on the screen and then click share. No, they don't see it yet.
Right. So what I'm going to talk about now, there's several different points in the PowerPoint. I had them really nice so you could see them. But now, since I have to do it manually, what I'm going to do, let me close this screen out so you can see better. Cancel. Okay.
Technology is a wonderful thing when it works.
When it works, right? So there's several points that I'm going to go over. And the number one point that I want to point out is it's called yin tong. And this point is located right between your eyes, where your eyebrows are, in the center of your eyebrows. And so that what this point does, it actually works on calming the system down. It calms the body, calms the mind, whatever is going through. If you're under a lot of stress, this is a great point to help with that. And also it helps with, if you're having a frontal headache, it also helps with that. Calming for anxiety, it helps with insomnia, helps with just calming the body down.
So then, should we just press on it or rub it, or
you just press on it? You just put your finger on it. This thing is tricking me up here. You just put your finger on it and then you press on it, and you just keep doing it in a circular motion. And then you do it for about a minute. And that really helps to calm you down. Whenever I'm doing my treatment, and that's the first point that I usually use, as soon as I put the point in the needle in that area, the person starts just getting really, really relaxed. And you could tell by the tone of their voice that they're getting there. And so that's number one. And some of these points that I'm going over, some of them are good for stress, and some of them are also, they have multi indications. So the same ones that you can use for stress, some of them you can actually use to boost the immune system. So those are the two that I'm going to be covering, the two topics. So the next one will be large intestine 20. And that one is located right here. And this helps with the immune system too. So it's located right here. So if you put your finger right here, and all you have to do is just press them. And I say do them together. This helps with allergies. It helps with clearing the sinuses and helps to boost the immune system as well.
I hope everybody in the audience is doing this right now.
Yeah. And then the next one, that's called large intestine 20. Large intestine 20, that, like I said, helps with allergies, runny nose, sinuses, and helps just to clear up your sinus area. The next one is lung 2. Lung 2 is located on your shoulder, like right here on your chest. So if you could cross your hand like that, right where your thumb points, not your thumb, but your middle finger, your second finger, you could feel it right just below your clavicle. If you press, there's going to be a sensitive area there. And that's on the lung channel. And that helps with boosting the immune system. You can feel that. It clears the diaphragm, clears everything up in the chest. If you have chest congestion, it clears it up. So just doing it like this helps. And this is on the lung channel. Now, the next one I want to point out is on your shoulder. You know, when you get stressed, you always have this tightness and tension in your shoulder. So if you can cross one hand across the other side and just find the highest point on your shoulder and take your finger and press it to the back just a little bit, just a tad, you will feel a sensitivity there. This is on the gallbladder meridian. The gallbladder works alongside the liver meridian. And whenever we get stressed, the liver gets heightened. The liver energy gets heightened. And because the liver and gallbladder work together, you will feel this tension. There will be a pull in that area. And so what happens if over time, the muscles start tightening up and they will pull up almost to your shoulders. So if you want to get it to relax, just cross your hand and do that. And this is on the gallbladder meridian, and this is on gallbladder 21. And it feels really, really good when you do it. You can actually feel a point. You should be able to feel a sensitivity when you press into it. And you're pressing moderately. You don't have to like kill yourself press, but just press moderately into that point. To me, I'm doing it and it feels really good right now as well. I'm going to show you on my little guy here as well. It's right in this area, right here on the shoulder. And you can press right in there. Now, the next one is going to be REN 17. And this also helps with opening up the diaphragm, opening up the chest area if you have a lot of congestion in the chest. It also helps with your breathing, the capacity to breathe, because it assists the diaphragm. And it's right in the center, right here between the bust line, where the breast would be, the nipple, in line with the nipples of the breast. It would be right in the center. So if you press on your body right now, you should be able to feel a sensitivity there. And all you have to do is just press it and rub it for probably about a minute. I'd say 60 seconds. And then you can always come back. So this is on the REN channel. And the REN channel, it goes all the way down and it ends underneath the tongue and it ends behind the scrotum or the vaginal area. Then this one now, it has a lot of different purposes. You can use this REN channel because of where it runs to help with reproductive health. It helps with hormonal issues as well. There's so many different things that you can do at that point. But today I'm stressing it for stress management and also to help with opening up the diaphragm. The next one would be on the large intestine point, which would be on your hand right here. So when you close your finger together, right where that little crease ends, and if you take it over to that second finger and press, I want you to press it now. Linda, can you feel that? It's very sensitive. This is on the large intestine channel, and this point is one of the major ones for frontal headaches. So if you're having frontal headaches, headache in the front of your head, the top of your head, all you have to do is take that point and put your finger there and just press into it. You're pressing and you're doing circular motion, and you just do it, and it feels really good as well. You will feel a sensitivity. When you're putting the pressure in, you want to put the pressure closer to that second finger, not so much to the thumb, but more to the second finger, this finger. And you'll feel the difference as well. Can you feel it, Linda? Okay, hopefully everybody else is feeling it.
Absolutely. Yes, and we all should be doing this right now.
Yeah.
Yes,
And
and I do feel, you do feel the sensitivity when you hit
Yes.
the right spot.
Right. And then when I put the needles in there, you'll feel like a tingly sensation just running up the arm. It's running along the channel of where that energy runs. So I have my little guy here, since I don't have my PowerPoint, this is where it runs. It runs all the way up. So when I showed you the one by your nose, that's actually in the same meridian. So if you do this point on your hand, you can actually help to clear up your sinuses as well too, and also helps with your frontal headaches. Okay. The next one I'm going to talk about is, large intestine 4. This one, something important I have to tell you on that one. That one is contraindicated in pregnancy. So if you are pregnant, or if you're showing someone to do this point and they're pregnant or think they may be pregnant, I would say not to do that point, because that point is contraindicated for pregnancy. So that one and the one on the top of the shoulder here, gallbladder 21 as well. So those two, if you're pregnant, I would say don't do those. Do the others. And we use that large intestine 4 point also to help with balancing the system. There's 4 points, major points that we use to balance it out as well. So when we put all the needles in, then we always put LI4 and liver 3, which is help to calm the system down. So that's usually one. When I get to the other one, I will tell you. Then the next one is stomach 36. Let me see if I have it here. Okay, so stomach 36, that one is on the side of your leg, just right beneath your knee. So if this was your knee and you put your 3 fingers like that right below the knee, right where the 3rd finger ends, right on the underneath and closer to the shin, you will feel a sensitivity there. And that's on the stomach channel. And the stomach channel has a lot of indications as well. We use it to help with nourishing the system, making sure the energy is moving so that the nourishment can be taken from point A to point B. Once the energy is moving, everything is moving, because the blood and the energy works together. So if there's a problem and an obstruction in the system, which is what usually happens when someone gets ill, then it gets stagnated. So what the acupuncture does and the acupressure does is actually helps to move the system, move the chi, the stagnation in the system, and helps the body, the circulation to go a little bit better. The blood and the chi works together as a paired unit. If the blood is not working well, the chi can't work well. If the chi is not working well, the blood can't work well. They're codependent on each other. And a good analogy of this is having a hose that has a kink in it. If the hose has a kink in it, the water will come out, but it's not going to come out to its fullest potential. But if you remove the kink, then it comes gushing out. So that's what acupuncture does. It removes the kink. It removes the blockage in the system that creates that tightness and creates the blockage there, so it stagnates. So once that is opened up, then the energy gets to move better, and everything is opened up, and blood and the oxygen gets to move better, and it helps to alleviate the problems that you're having. So let me see if I have everything else inside. Okay, so the way how pericardium 6. This is another one for stress. And pericardium 6 is on the inside of your wrist right here. So it's 2 thumb, like if you had 2 thumbs, so that'd be 1 thumb, 2 thumb. Just beneath that 2nd thumb, in between the tendon, right in there. If you press in there, this is an amazing point for anxiety, for depression, for nausea. This will help a lot. And all you have to do is put your finger in there, in between the tendon, and you press. It's a little deep. So even when I put the needle in, I have to go between those 2 tendons to find it. But once you find it, as soon as you put it in, the person goes, And they
Do
start
you
relaxing.
have to do that on the right arm or the left arm or both, or does it matter?
Doesn't matter because the same points are on one side, is totally on the other side. And the great thing about acupuncture is you don't have to fix, if the person has a problem on their right side, you can actually fix it from the left side. You can fix it from the top, from the bottom, because the way how the meridians run, they are all interacting. These are the primary ones that you're actually seeing on the little statue guy here. These are the primary ones, but we also have meridians inside, which are considered as extraordinary meridians that are not on the surface. And you can only access them by way of the main meridians. So you have to know what points intersect with what other meridian in order to get those. It's amazing how it works and how the system is set up. God made our bodies in a wonderful way that our body is meant to heal itself. And that's what acupuncture does. It helps the body to remind it to heal itself. So let me see if I missed anything. Okay, so I wanted to also talk to you guys about the chi, right? So when I talk about chi, I mean the energy of our body. It's called also the life force in our system. Every living thing has chi in it. Chi is something that's invisible. So don't ask me how they found it out, but it's there because now we have landmarks. We have something that shows that this is chi, the chi is there, right? However, when you see, when you turn on the light switch, the energy comes, the light turns on, right? You never really see the light itself, the electricity itself. You see the effects of the light switch turning on, the effects of the light, the electricity. The same thing, if you step outside and you see the wind blowing, that's energy as well in another form, right? The tree will blow, the tree will rock towards it. That's how we know there's a wind, or we feel it against our skin. That's the same kind of energy that's inside our bodies. So when I put the needle in those points, what you'll feel is a gentle electrical sensation. It's amazing. Once the needles are in and in place, you will feel the energy just moving back and forth and back and forth. Sometimes you'll get the feeling of like you're floating on a cloud. It's really, I can't even explain how it feels, but it's amazing. There's different sensation, different people feel different things. And the points that are most sensitive are the points that has the most issues in the problem. So if somebody comes to me and they're highly stressed, that's one of the major things that we see patients more to is stress, and especially during the time of COVID. So when they come in, those points are even way more sensitive, the one on the feet. So the liver meridian is one more that I didn't go over yet, and it's located in between the big toe right here, similar to the one on the hand here, right? The one that we showed you on the thumb. It's similar. So it's right in between the space of the big toe and the second toe. And I don't know if you can see it here since my thing is not working, my PowerPoint. But anyway, if you can find that, if you touch it, you will find it, because if you press it, you're going to feel a sensitivity to that point. So those points are usually the ones that I would put the needles in addition to some other things, and so some other points. And all of these, you'll feel like a little sensation of the energy. When we put the needle in, that's really what we're trying to feel. It's called the arrival of the chi. The chi is already there, but it's like you're stimulating it with the needles. The needles are metal, and because they're metals, it stimulates the energy. So that's what you really feel when you put the needles in. And there are different ways to do them. There are different types of techniques in regards to acupuncture. And so for me now today, I don't have enough time to go over it because I could tell you way more, but that's all. I'm going to leave some time out for questioning. So if anybody
I'm glad to hear you say that, because we already have several questions coming up. I have a few myself, but I think we'll see some up on the monitor in just a moment. There you go.
Okay, how effective is acupuncture treatment in managing asthma and allergy and breathing issues? It's very, very effective, because like I said, this is not enough time for me to go over it. However, because when we're treating allergies, we're not necessarily treating the allergy. The whole goal for all of the treatment is to balance the system. Everything happens because there's an imbalance in the system. So the whole goal is to balance it. Now we have to find out what's causing that. So a lot of times it's emotional. You would be surprised. but the emotions has a lot to do with the physical body. You can't fix the physical body if the emotions are not addressed. And so that's why acupuncture is a mind, body, and spirit medicine. We look at every single thing in order to treat. One of my main questions for my patients is about their emotions when they come in for an evaluation. And each time they come in, I try to figure out what their emotions are so I can adjust the treatment during that time when they come in to address that as well. So it's very, very effective. It may require more, depending on how long you've had asthma. It's not going to happen right away. It will take some time, but you'll get, you'll gradual improvements along the way as you go. But it's very, very helpful.
Okay, great. I think we have another question coming up.
Okay. How helpful is acupuncture with injury recovery? Very, very helpful. And like I say again, because we're not really treating the injury per se. So say, for instance, you got a car accident and you hurt your neck or you hurt your back. We're treating that, the local thing, but we're also treating the disruption of the emotions that's also attached to that. Because if you think about it, there's a lot of stress. There's a lot of emotional things going on because you got hurt as well. So all of those things make up why the body is doing the things that it does in regards to responding to the injury that it got. So yes, it is very, very, very effective in injury as well. And like I said, depending on what the issues are, it will take certain time to get that taken care of. You just have to give it time to work. And some people get really fast results, and some people may take longer. One thing to consider is that the more acute the issue is, the faster it will help. It will get cleared up. The faster you'll get the results. The longer you've had the issue is the longer it may take for you to get the results, but you will get results. And acupuncture is not for everybody. And the thing is that it works the same way. And I usually say because it works well in animals and they don't have a belief system, because some people say you have to believe it for it to work. That's not necessarily true, because we use acupuncture as well for animals and it works amazingly as well too. So it's just a matter of each person's body and how they handle it.
Okay, and I think we have a follow-up from the first question.
For asthma, in case of kids, your experience, how long does the treatment range? So the treatment itself, when we're doing it, the treatment lasts about 30 minutes. For the first visit you're coming in, it's going to be about 90 minutes because you're doing the evaluation and the treatment itself. Well, it depends too on the course of how long the child has had the asthma. But I could say anywhere from probably about 12 visits, depending. Then the person will actually be feeling really good. And after that, you want to continue with a maintenance program. We have a maintenance program set up as well. So once you get done to, where you're recovered, then we start setting you up on a maintenance program so your body can continue to take care of itself.
Okay, great. Great information. If there are no more questions posted, there's another one.
Okay, what benefits is acupuncture for athletes and high-performing individuals? It's amazing. And there's a lot of sports athletes who uses acupuncture to help to boost their game. Because the thing is that with the energy moving and the blood's moving, it helps to clear up the stagnation in the muscles and tissues as well. Also helps with brain health with regards to having the person be able to do the things that they need to do because they have a clearer focus and they can concentrate a little bit better on what it is that they're doing. It's amazing the different modalities that we have, and they all work differently with regards to what Dr. Karen was saying as well too. I was thinking about that we all have different modalities, and the whole goal is to bring the body back into balance. So yeah, it works for everybody. I've had a few sports agents as well too that I've worked with, athletes, from baseball and from basketball and even football that they play here in Jacksonville, and I've worked with a few of them as well too, and it's helped very much so. And one of the things that I do, I really educate my patients a lot when they come in, because I find that an educated patient is very proactive in their health, and it's really good to have them know what they're getting into or what they're doing and what they can do to maintain their health. So I'm big on educating my patients.
Okay, great. If there are no more questions, any more questions on the banner? Yes.
How many sessions are typically recommended? And there is a different recommendation for acute tissue versus chronic. Okay, so how many I don't really recommend any specific time frame because I can never tell what the body's going to do. It all depends on the system, because each time when you come in, I'm going by what you say, and what the tongue and the pulse present is what the indicator of letting me know how well you're feeling. So some people may take a longer time. I'd say average about 12 visits, depending. Some people be like 8, but it all depends too on the severity of the problem that you're working with, and and the way that they follow through with the indications that we give them to do. Because I give everybody homework to do. It's one doctor you come to and you get homework when you leave. So yeah, there's always something to do. So it depends. For chronic or acute issues, like I say, with acute issues, you may be able to get some good results between 6 and 8 treatment. And then for more chronic, it may be 12 or more. But the goal is to, once you get done, is to stay on a maintenance program, because it makes a world of difference.
Okay, great. Thank you. Any more questions coming up on the monitor? If not, there we go.
Wonderful information, Rosemary. I am impressed that you don't see it as just treatment but
se.
connected to emotions. Yeah, it's really, really important to see that is connected to the emotions, because everything that you have happening physically has an emotional component to it, depending on what's going on in your life. Because if you got injured, like we talked about earlier, it's going to end up with an emotional component. If you can't work and if you can't move, you can't do your lifestyle and the things that you used to do, you can't really do it, because of the fact that your body's all messed up. So it affects your brain, it affects your mind, and sometimes people will get depressed. So it's good that we're working with both sides that we're treating. And then another thing is too, the emotions also are governed by different organs. It's amazing. When you come in and we do the evaluation, we can tell if someone is under a lot of stress just by the emotion that they say they have. I have a list of emotions, and you check off which ones are most dominant for you. And everyone that you check off that's most dominant pinpoints the actual organ that's out of balance. Your sleep pattern also pinpoints when your body's out of balance. Liver, anybody that's waking up between 1 and 3 or 11 and 3 in the morning, usually the liver gallbladder is off. Because in a 24-hour cycle, your body's on the clock your organs are on the clock for 2 hours, predominantly being taken care of. So in that point in time, if there's something going on and there's an imbalance in the system, you're going to be more fatigued or agitated at that point in time. So we look at that as well too. Once we know that, then I know exactly what points I need to add to the treatment. It's amazing. You guys need to go check out the website. There's some more information on the website as well. And if you want to just do a phone consultation, I'd be happy to do that for you if you have questions.
Okay, great. So in the next 2 or 3 minutes, can you give us your top 3 takeaways for our audience today?
Oh, yeah. My top 3 takeaways are pretty simple. It's acupuncture is a natural and holistic approach to maintaining and achieving good health. If you achieve it and maintain it, you can use acupuncture to help with that. That's number 1. Number 2, you don't need to be sick to have acupuncture. You can be just fine, but acupuncture will help to boost your system and keep it going where you don't get sick. It helps to balance and maintain and harmonize the system and prevent you from getting ill. And then the third one is to find ways to manage your stress, because stress is the culprit behind many different diseases. Stress is one of the major ones that I see in my office. I would say about 90% of the patients that coming in, they may be coming in with different things, but usually points to the stress. So one of my first goal, no matter what I'm working on, especially, people are working on reproductive health and fertility, we want to try to get the stress down, because if the person is so stressed out, their body is not able to do the things that it needs to do. So yeah, big time. So really work on stress management. You can do meditation, deep breathing exercise is one that you can do. And I always tell my patient to do this 5-5-5, I call it, where you breathe in through your nose and 5 count. You hold it for 5 count, and you exhale through your mouth on 5 count, and repeat that 5 times. The 5 times is a set. You can do it as many times as you want to. Of course, if you're getting lightheaded, you're doing it a little bit much, so you take a break. But that's also calming the stress and bring your emotions down, bringing oxygen into the system and helping to just make you feel good. Actually, if you're at the
That
office
is
and you're under a
excellent.
lot of stress, just stop and then do that.
That is just excellent information to wrap up your little session here today, Rosemary. I can't thank you enough for coming and sharing all this wealth of knowledge about acupuncture. Ladies and gentlemen, she does an outstanding Tweener massage. It's a head to toe. I treat myself every once in a while to a massage like that. Rosemary Allen, I thank you so much for joining us today on day 2 of our wellness weekend. And
Thank
what
you
I'd
so
like
much
to
for
do,
having me.
what I'd like to do now is close our wellness weekend with a speaker who prides herself on combining both Eastern and Western ideology. Folly Shaw is a woman with a diverse educational background and a unique set of skills. She has traditional degrees in psychology and psychotherapy, but she's also has certifications in pranic healing, crystal therapy, and arhatic yogi. She was trained in her native India, and she strives to bring India's culture to the United States. Folly believes that using ancient and modern techniques to restore the flow of vital life energy can help the body to heal itself. We heard Dr. Ellen talking about that very same thing. Folly is the founder of the beautiful, and it is a beautiful spa, Seventh Wonder Holistic Spa in Jacksonville, where it's a sanctuary away from all the stressful environments in this world. It was founded in 2002. They specialize in wholesome and holistic approach to heal your body, mind, and soul. As I said, combining Eastern and Western ideology. Today, she's going to focus her thoughts with us on Ayurvedic and energy healing. Please, ladies and gentlemen, welcome Folly Shaw. Folly, to you.
Thank you and namaste, everybody. I'm very grateful to have you on board. This is my first time with Indo-US Chamber of Commerce for inviting me. Linda, thank you so much for bringing me here. And of course, Rosemary Allen, she also has pulled me over here. So thank you, all of you. And I'm very grateful. Okay, so we are in Jacksonville, Florida. And yes, I've been practicing from 2002, but I've been doing my skincare since 93 actually. And become a healer in 2001. I become a Reiki healer, and then I become a pranic healer, and I went all the way in mastering in pranic healing, and I did Reiki mastering also. And whenever I go India, I always learn Ayurveda or always something I'm learning there and bringing over here. This United States has raised me up in here. I'm very, very grateful to United States. And so I am going to talk about something about Ayurveda also, that Ayurveda has been here in United States. It's lately, it started with yoga. When I became in 2002, when I opened my spa, at that time there wasn't any yoga studio or anything that time, but then it started opening up more and more yoga studio, and I feel so good about that more people are getting aware of. And when in 2002 there was no understanding about Reiki or pranic healing, so in my opening of the spa, and I was really wanted to offer that Reiki and pranic healing, because how I do that, how open up people's mind, then I started putting as a chakra energy work. And people are starting understanding chakra because they were doing yoga. So from yoga, they were able to understand chakra, how chakra is and where chakra is, but still not complete understanding about chakra. And so I made it in all the packages. I put chakra balancing that time. So it's like Day of Seven Wonder, and it has like a chakra balancing in it. So no matter what, they have to get it. And once they get it, they like it. They feel that, oh my God, that is something you did. It was fascinating. It was so amazing that I feel better. And there was a one girl came in the that package. She was from Orlando and she was a yogi and she had an injury in her thighs. And that time I did that pranic healing actually on her as a chakra balancing, but completely got healed right on the table. She was able to move her movement of that hips and her pelvic area. And then 2 months later, she called me and say, oh my God, Fali, I'm completely healed. I'm able to do my all yoga poses. So it's again, it's like how much you are connected, how much you are getting into that, then you will be able to receive it, you know. So same way, after that, I started learning about Ayurveda also. So whenever I go India, again, I wanted to bring something. So I found about Ayurveda I wanted to bring. That is from my childhood. I was learning from my grandma. And that's how I started understanding what is herbs and how it is able to heal. So I have lots of input from my grandma, my father, and my mother. So that's what I am using in here in my Seventh Wonder Spa. So there is a Ayurvedic system. Ayurvedic is a very fascinating system. It's like a 5,000, more than 5,000 old technique, you know, to how to live life. So how to balance yourself with living life. And so that's how it's like. I'm going to show the, share my screen also on Ayurveda. So Ayurveda, that's how it is pronounced. And next one is, so, and we are doing like a consultation over also in spa. And living a life with Ayurveda, it's like a science of life. So you have to have discipline in your life. Then you will be able to follow Ayurveda. There is a 3 dosha on Ayurveda. Let me share. I'm able to share that.
Can you advance the slide?
Yeah, that's what I'm trying to do.
Again, technology is a wonderful thing when
I
it
thought
works.
I'm connected. What happened here?
You are connected.
It got stop screen. Okay, let me share
It
screen.
stopped now.
Okay, I'm able to share.
Try it again.
Okay.
Okay,
Hopefully.
that's your first slide.
Right. Okay.
There you are.
Thank you. This time it worked. Thank you, technology. Okay, so there is Vata, Pitta, and Kapha. That is our more 3 constitution of our body. Our body is made with 5 elements. So 5 elements has ether, air, earth, water, and fire. And they all are connected with our system. Our whole system is made with this 5 element. So sometimes it's one element is higher than other element, and that's how it get issues in our system. So that is, let me make you understand on that also, that how Vata body has more air and water. So that because of air and water, their skin is getting dry. They are more light. so they are more moving kind of. They get more cold, their skin is more rough, but they are very mobile. Vata in people are more airy, and they have ether space in it also. So that's how they are very moody and kind of moving around very quick. It's like airy. And there is control of movement in the body. They get heartbeats, gastrointestinal, blood circulation is kind of get issue with that. Then there is so many other issue also can have in Vata. It's a Vata body can have poor blood circulation. They feel very cold. Respiratory issue they have, then they have heart palpitation, hearing problem, loss of senses, osteoporosis, arthritis, constipation, and bloating. So those issues is called Vata. Vata is a Vayu, it's the air. So those issue has been created through the Vata. Then we have to make it that Vata into balance, to take some herbs and take some, treatment on it. So we do like some of Ayurvedic treatment that is called Abhyanga massage. So that will really help on Vata people to do that Abhyanga massage. Dry brushing also can help. So same way it affect on mind, insomnia, anxiety. They are very moody. They get dementia, Alzheimer, mental stability. So, and they get very fatigue and restlessness. So those are all connected with the mind. So we give the treatment on that, and we have we don't say doctor, it's a Veda Goswami, and he is from India, and he gives really good consultation. According to that, he prepared the herbs for it, and from that herbs, you take it like a making concussion. It's like a tea or something. Sometimes you have to take naturally, and sometimes he prepare the oils and we give the massage according to that, and that is we use for that. So there is a Pitta is fire and water, and Pitta people are more having hot. They can be more fiery, and they are very sharp. Skin is oily, but they get like heartburns and skin issues. They have rosacea. They get lots of sensitivity in the skin. So that is like a transformation in the body with digestion, metabolism, digestive enzymes. That is for the Pitta, controlling that transformation. And now it's the body is constantly feeling hot. In the Pitta environment, they are a Pitta constitution, so they get sometimes very hot, and excess on false smelling in sweat also. So it means your Pitta is out of balance, and premature balding and gray hair. They get poor eyesight, light sensitivity, and hyperacidity. They get heartburns, acid reflux, and ulcer. So that is like a Pitta constitution. They are into that. And according to that, we prepare the oil and stuff to give massage during that time also. So all the first other thing also I wanted to say that Vata, Pitta, and Kapha, you sometimes say, okay, I'm more Pitta, but it's not always going to stay like that. Every time with our system is changing, our environment is changing, and our whole body is connected with star and moons and all that. And it's all the like weather also change. So everything change in our system. It's not continuous you're going to be Pitta, it's not continuous going to be Kapha. So all the time things are changing. And situation with Pitta, they are more anger, they get more frustration in the mind. They are competitiveness, stress, irritability. They get very fast irritable. They get hatred and very impatience. So that means that person is more Pitta related. So this is like, we sometimes think that people are like, why like that? And we blame on them why they are like that, but we don't understand there is a situation going on inside that system. That's why they are like that. So we have to always give some chances on that. So that's what I always think that way, you know, that everything is not what you see, because what is going on inside, there is more deeper also is going on. So Kapha is with earth and water. So they are more heavy, they are more slow because they are heavy. Skin is more oily, but skin is more soft also. They are not dry, dense, just like earth and water. Its kapha is more present in lungs, lymph system, joint, muscles, sinus, and nose and tongues. So there you feel more kapha related issue. It controls structure in body, is lubricating quality, relieves friction between cells and organs. So kapha is sometimes, it's very good to have in the between the cells and organs, because it's giving the movement of the lubrication. So kapha people gain weight very easily. They get very lethargic very easily also. Mucus get built up, white coated tongue, then swelling, water retention, all that is happening in that kapha out of balance. And their mind is become more lazy. They can be more depressed. They can be loneliness, sadness, and they feel more jealousy, and they get more attachment also with the things. So there is a mind, body, and all that is get connected with that, you know. So everything is related with mind, body, and spirit. Okay, there is other science also, is called Mudra Vignan. So this Ayurveda is very, very interesting subject. It's a really big science, and it is coming more and more into US. I'm very happy for that. People are getting more and more understanding. So yoga is connected with Ayurveda. Ayurveda is the main tree, and yoga is one of the branch. Then there is a meditation, then there is a chakra. All that are connected with the Ayurveda. It's the full thing is connected with Ayurveda. That's how all the rishis and gurus, they were all practiced in India like that. Everything is connected with one. So there is a fingers, and the basic element is a fire, is our thumb, air is the first index finger, ether is the space, and earth and water. And again, you can see that fire is connected with Venus, Mars, air is connected with Jupiter, and ether is Saturn, and earth is the sun, and water is Mercury. So all the stars and everything get connected with our body like that. We are with 5 elements, we merge into 5 elements, and that is very interesting science on that. So let me talk about little bit about mudra also. So mudra is, that first one is the Musti Mudra, it gives you more self-confidence. So when you are feeling lack of confidence, just do that mudra. It's a gesture, and you will feel more confidence on that. And it reduces your anxiety. So that is wonderful. Then other one is the Vayu Mudra. So your fire and air is get connected together, and you are pressing on the air in the index finger, and that is also helping to your any kind of issue going with your pain, arthritis, rheumatoid arthritis, anything. It really helps once you start using. If it is the beginning of that, then you start using that mudra, and that will help in that, and gives you mental clarity also, because it's air, it's doing that. Then the third one is the Surya Mudra. So that is like a sun you are using, and then earth. So Surya Mudra is solar and fire. So it digests and metabolism and reduce heaviness, and it burns fat and bring heat to your body. So that is Surya Mudra. So that is third one. And then there is the Buddha Mudra. So that is the air, fire and water. So fire and water get connected. That will help into Buddhi Mudra. So it gives you mental clarity. So, and reduce dryness from your skin, from your body also, because it's connected with water and fire. That Kama Joy Mudra, that is Kama Joy Mudra, there is a Jnana Mudra, and then this is like a Kama Joy Mudra. So you are pushing all ether, earth, and water in the downward, and then only fire and air is connected, and that is helping you into self-control. It regulates you in self-control and sexual energy. So that is wonderful to go in higher level, also in spiritual level. So then there is a Prana Mudra. Yes.
May I interrupt you for a moment? We are running very short on time here, and I don't think we're going to have enough time for questions, but if you'd like to finish with the positioning of the hands.
Okay, I can go with the other slide then. Let me do that. So we offer all this treatment in here. And I have done pranic healing. Our body auric field is connected with soul, mental, emotional, astral, and etheric physical body. So that is our auric field. So when our healthy aura, you can see how healthy aura is, and when it is dirty aura, then you can see its aura has broken down. And this is done with Kirlian photography. So there is a camera like that can take this picture. This is all major chakra. So that was my pranic healing thing. So major chakra is related, like Dr. Ellen also suggests that, said that how meridians and all are connected with each other and how these chakras are. So this is all chakra function like that. And we do pranic healing system. I do that here. And this is our thought forms. And this is twin heart meditation, is amazing meditation. We do it right here. First and third Tuesday, 6 to 8. And all this treatment we provide. And pranic healing, I do it on like a virtual also, with over the phone, video call or anything, we can do that treatment. So whenever you wanted to do that treatment, you don't have to be here, and again I can do that treatment. So I'm sorry. That's for
terrific. No, it sounds like there's a lot of information, and maybe next time we'll have you back and you can talk more about it. But for now, what I'd like to do is, if you can quickly give me a point or two you'd like to give people to take away.
Okay, this is one thing I wanted to say, to keep it more open mind on alternative medicine or alternative therapy, that we are offering like pranic healing, Reiki, and consultation on Ayurveda. So be open for that. And other thing is we are doing like meditation. So come together here, and that will be send out lots of love and blessing to whole universe. It's very powerful meditation. I wanted you guys to join with me sometime.
Thank you very much. Ladies and gentlemen, this has been just an amazing, eye-opening presentation from Fali Shah at the Seventh Wonder Spa. And I've learned a lot. Are you in your salt room now?
Yes, I am in salt room. This salt
Okay,
room has
great.
a very good benefit in, it's like 82 minerals is connected with salt, and it removes all negative ions. So it really helps to breathe better in respiratory system. It helps in your skin and all the, and relaxing. And we do like a couples massage in here. And we even offer singles treatment in here also. So it's like a treatment
Terrific.
room.
Excellent. Well, I want to thank you again on behalf of the Indo-US Chamber for closing out our Wellness Weekend. And we'll say
Thank
goodnight.
you so much.
Namaste. Ladies and gentlemen, I hope you have enjoyed today's speakers as much as I have and taken away some good information to make 2021 a happier and healthier year. Once again, we thank our speakers, Dr. Gouda, our veterinarian, Dr. Karen, our hypnotherapist, our acupuncturist, Rosemary Allen, and our pranic and Ayurvedic healer, Fali Shah. This event and yesterday's event will be posted on the Indo-US Chamber's website so that you can view it again at your leisure. It's been my pleasure to spend time with you, and what I'd like to do now is introduce back to the stage the hardest working president of the Indo-US Chamber, ladies and gentlemen, Amuda Sundaram. All right, that's your cue. There you are, Amuda.
Myself. Thank you so much, Linda, and thanks to all our speakers. They have provided the wealth of knowledge on the overall well-being, as well as we covered about the pet wellness too. Thanks to everyone who actually joined the event, who will also watch our recording later. Thanks to our event sponsor, First Coast Heart and Vascular Center, as well as Blue Star Pet Hospital. Thank you so much for supporting this event. And I would also like to give a special thanks to our leadership team, executive committee, as well as the board members for coordinating, organizing this event, and making sure this event comes out successfully. As we end 2020 close, getting this year end, we would like to start our new year with a fresh mind as well as with a healthier mindset. So let's get ready for a healthier 2021. I hope everyone enjoyed this event. Please watch our recording both on Facebook as well as YouTube. You can also follow us on Instagram. So we will post all our new future events later. Looking forward to connect with you in the future. Have a very happy, wonderful new year, 2021. Thanks everyone for your time.